you be cancer-free? Doctors from the Arizona Natural Health Center are here to share steps you can take right now to be a survivor.
Well, nowadays, it seems that there isn't anyone who hasn't been touched in some way by cancer. And it can really make your heart stop if you hear that diagnosis. But our next guests, they say there are some easy things that you can do right now to fight back. Joining me now are Drs. Heather Paulson and Dr. Elizabeth Rice with the Arizona Natural Health Center to give us some tools to help combat cancer. Thank you both for joining us this morning. I'm real excited that we are talking about the big C, as we like to call it. Before we get started, can you tell us a little bit about both of you? You're both naturopathic doctors.
That's right. We're both naturopathic doctors, and we practice at Arizona Natural Health Center. We're 2 of 9 physicians in that practice.
Yeah, Dr. Paulson and I treat patients with cancer, and we also treat their caregivers too, kind of encompassing the whole cancer family, supporting them.
It certainly is a family. When you are struck with cancer, when one family member, one friend, it really does resonate throughout the entire household. February, it is National Cancer Prevention Month. Can you talk to us as doctors? You focus on natural treatments for cancer. Give us some examples of how we can help fight cancer and be a survivor.
Right. Well, cancer prevention comes to a lot of different things, and we like to boil it down to 5 simple steps that people can use to prevent cancer. A lot of people think that cancer happens because of genetic risk factors, but in the research we find that that's really only 5% of all cancer risk factors are linked to our genes.
Yeah, so Dr. Paulson and I created the Great Life program, and it's 5 simple steps that we pulled that the literature has shown has been really effective in reducing cancer occurrence and cancer recurrence. So G, the first letter in GREAT, stands for get active. And Susan, you were just getting active a few minutes ago.
We love
that was perfect. Yeah. And the research shows it's about 30 to 40 minutes of exercise a day, 5 times a week, is what can produce risk for colon cancer, breast cancer, and prostate cancer. However, just like how you did, if you break it up into little increments, 10 to 15 minutes throughout the day, maybe that's easier for some of us who are more busy.
And I mean, that's just going for a brisk walk after dinner with your entire family. Again, incorporating the entire family. We have some fruits and vegetables on the table and some other important useful tools. Now we're going to go to the letter R.
Right.
Explain what R is.
So
reducing your risk.
R is to reduce your risk, and to reduce your risk, we often encourage our patients to get certain lab tests done, like vitamin D. Vitamin D has really been looked at in terms of reducing risk of cancer recurrence and also cancer prevention. But there's lots of other things that might be individualized to you as a unique person who has other health conditions like diabetes or high cholesterol, obesity, things like that. We will work with you to reduce your risk.
Okay, the letter E.
E, eat to live. And so we brought with us, some beautiful fresh organic vegetables. It's important to eat a diet that is highly based in plant foods, and also to try to eat a variety of colors. So eat the rainbow, reds, greens, yellows. Things like the dark leafy greens and flax seeds and pomegranate juice are very helpful in preventing cancers.
And A for the letter A.
A is to add meaning. So one of the things we see lacking in people in general is that sense of connection, that sense of community. And there's a new emerging research group looking at positive psychology and how that actually impacts our hormones, our health factors, and our longevity.
And T.
T is think green. This is talking about your environmental exposures.
And we have a couple of things here, easy swap outs for you to think green. So I like to encourage people to put things on their skin that they'd be willing to eat. So we have honey here as a great exfoliant and moisturizer. And then swap outs in the kitchen include adding a cup of vinegar to your dishwasher to help clarify your glasses instead of using those other kind of glass clarifiers.
All right, great. I mean, this is great advice. And this is stuff that we, again, have probably already in our house.
Absolutely.
And maybe we're not using it in a more we can use it rather in a more effective way. Or if you don't have it, go to the grocery store and pick it up. It's simple things. Well, ladies, thank you so much for joining us and for giving us these great tools to help be a cancer survivor. And Arizona Natural Health Center, they are offering a free 15-minute cancer risk assessment. That is one of the GREATs, of course, of of course, getting tested. And they are taking appointments all month long. The clinic is located at 1250 East Baseline Road, Suite 105. That is in Tempe. The number is there on your screen, 480-456-0402. You can also find additional tools on living a cancer prevention lifestyle on their website, aznaturalhealth.com, and that is Suite 104 in Tempe. Again, doctors, thank you so much.
Thank you.